Hello and very good evening, friends. I'm Dr. Mukhmohit Singh, and today we are going to have a short and a crisp live session. It will take us around an hour or so, and we are going to discuss how to approach community medicine. I know that the exam is delayed, and ये क्योंकि exam delay हुआ है, तो अब ये जो 2 महीने हैं, काफी स्टूडेंट्स के हमारे को वी हैव बीन गेटिंग मैसेजेस दैट हाउ आर वी गोइंग टू गो अबाउट इट एंड क्या करना है. So this session is basically orienting you how to approach towards community medicine in the upcoming 2 months or whatever time we have left for the FMG exam right now. Plus, I will be discussing salient high yield topics and MCQs जो कि एग्जाम में आने की maximum probability रहेगी. So beta, first come first, how to prepare for community medicine in these 2 months or so. As you can see, I have divided this whole section into 3 topics. Like there are 3 gross sections, one section, section 2 and section 3. Each section is having 7 topics. First thing that you have to do is these 21 topics that I'm giving to you. These topics are the most high yield topics for your exam, and you do it in step 1, then step 2 and then step 3. So first you are going to do these topics, these chapters: national health programs, communicable, non-communicable disease, mother-child health, immunization, family planning, and epidemiology. These topics are going to, this is like 50% of your syllabus. Next 30% of your MCQs are from nutrition, environment, occupational health, biomedical waste, demography, plus these 2 special topics, biostats and screening. But प्लीज मेक श्योर कि इन 2 टॉपिक्स पे, बायोस्टैट्स और स्क्रीनिंग ऑफ डिजीज पे, आप इतना स्ट्रेस नहीं ले करेंगे. मैक्सिमम क्वेश्चंस आते हैं टॉपिक फर्स्ट सेक्शन में से, नेशनल हेल्थ प्रोग्राम, कम्युनिकेबल डिजीज, मदर चाइल्ड हेल्थ, इम्यूनाइजेशन. नेक्स्ट आता है न्यूट्रिशन, एनवायरनमेंट, ऑक्यूपेशन, एंड लास्ट में यू हैव दीज मिसलेनियस टॉपिक्स व्हिच इज लाइक 20% ऑफ योर सिलेबस. सो व्हेन यू आर प्रिपेयरिंग फॉर योर एग्जाम, ये टॉपिक्स हैं, ये चैप्टर्स हैं, इनको बस यू जस्ट डू लाइक यस आई नो दिस, यस नो आई डोंट नो दीज टॉपिक्स आर वेरी इंपॉर्टेंट. अब नेक्स्ट आता है कि इन 2 महीने में हमने करना क्या है. यू हैव टू प्लान फॉर 2-3 थिंग्स बेटा. पहली चीज तो है कि अपने स्लीप को आपने इग्नोर नहीं करना. व्हाट, हाउ मेनी आवर्स यू स्लीप इज नॉट गोइंग टू डिफाइन के आप एग्जाम क्लियर कर रहे हो या नहीं कर रहे. व्हाट यू डू व्हेन यू वेक अप इज गोइंग टू डिफाइन. पहली तो यही चीज है. और अपने आप का पूरा अपना हौसला जो है ऊपर करके रखना है. यू हैव टू कीप योर स्पिरिट्स हाई कि हमने एग्जाम को क्लियर करना है, अपने स्लीप साइकिल को डिस्टर्ब नहीं करके. So make sure you are getting adequate 5-6 hours of sleep, minimum 5-6 hours of sleep, and उसके बाद आप उठ के तैयारी करते हैं. तैयारी के अंदर what you do is going to define like how many marks या आपका एग्जाम में अप्रोच कैसा रहेगा. इसमें जो स्टूडेंट्स अभी थ्योरी में वीक होते हैं, दे ऑलवेज फॉलो 50% ऑफ टाइम इन थ्योरी एंड नोट्स एंड 50% टाइम इन एमसीक्यूज. बट दैट इज रॉन्ग वे राइट नाउ. यू जस्ट हैव 2 months एंड ऑलरेडी एग्जाम अभी पोस्टपोन हुआ है. Maximum 90% of your time, it should be divided in the ratio of 90:10. 90% of your time beta should be going in solving the MCQs. You are going to give an MCQ exam, and MCQ exam के लिए ही आपको MCQ के जैसे ही तैयारी करनी होगी. 90% of your time you should solve MCQs. काफी students message करते हैं कि sir, should I do the revision notes again or should I do the question bank या फिर मैं grant test दूं, क्या करना है. Best answer is always go with the grand test, always go with the mock test, always go with the subject wise test. Do maximum number of MCQs. That is what you are meant to do. So 90% of your time you should be spending on MCQs. MCQs कहाँ से करने हैं? You can choose any platform. Marrow में you have specially the FMGE Q banks. You solve those question banks. You do them once, you do them twice. अगर सारे कर लिए हैं, उनको दोबारा करो, because those things are going to help you. प्लस इसके अलावा आई कैन नॉट अंडर एस्टिमेट द पावर ऑफ ग्रैंड टेस्ट. ग्रैंड टेस्ट जो देना है आपने, just a moment guys, I think the yeah, जो ग्रैंड टेस्ट देना है Make sure that whatever grant test you are giving, it should be in a timed manner. Time management करते हुए you see what all areas are your weak areas and कहाँ पे आपके strong areas हैं, वो grant test देते हैं. At this junction, you should always get the habit of using flashcards and one book concept. Make sure कि आप ये भी पढ़ लें, ये भी पढ़ लें, ये भी पढ़ लें. Different sources को अगर आप लेते हैं, make sure that you compile all the sources. In case you are doing that, you compile all the sources towards one book and one book को आप आगे तैयारी करते हैं. So always, it is always advisable that rather than studying 5 books one time, you should study one book only 5 times. So अगर आप एक प्लेटफॉर्म पे हैं और उसके ऊपर you are trying to assess the MCQs and you're doing the MCQs, do that again and again. Keep on revising the same set of MCQs, the Q bank. I'm not saying you do single test. Q banks को ही रिवाइज करना है. अब इन 2 महीने में करना कैसे है? In 2 महीने में, I know this is a very small screen, but what I have prepared for you is a short a Gantt chart, you can say a time chart, कि इसमें हमने starting from 20th November, what are you going to do? So I have given like 3 days per subject, 3 to 4 days. Medicine को 3 दिन में खत्म किया, surgery को 3 दिन में खत्म किया. Then you have other bigger subjects like obs and gynae we have done. Obs and gynae in 3 days. Then you have pediatrics in 3 days. Then you have pathology, microbiology, physiology in 3 days. So इस तरह से अपना एक चार्ट बनाओ, अपना एक टाइम टेबल बनाओ that you are going to follow till 17th 18th January. इसमें what I have done is that on 8th of January till 8th of January I have completed all the subjects. हर सब्जेक्ट में हमने टारगेट लिया है that for every subject target is that minimum I will do 300 to 500 MCQs. For subjects like medicine है, surgery है, of course you can take up till 1000 MCQs, but minimum आप मुझसे वादा करो that you are going to do 600 MCQs minimum in medicine surgery in the next 2 months. Plus, subjects like PSM, pathology, micro and pharmacology, which are the base building subjects, you do at least 500 per subject MCQs. So take 2-3 days and हर 2-3 दिन में try to solve maximum number of MCQs. 200 MCQs, 300 MCQs per day is not a very big deal. तो इतने तक पहुंचना है. अब आपको जो other subjects है like anatomy, physiology, bio, which are very volatile. Biochemistry है, anatomy है, IENT, and yes, they are very important for your exam also. ये 300, 400 plus other shorter subjects you can do minimum 300 MCQs each. ये करते करते you are going to finish the syllabus. Make sure that you are able to finish the syllabus by 5th or 8th of January. Last के 10 days में, last 10 days, every day attempt grand test, timed mock test, बस यही करना है. At least in these 2 months, नेक्स्ट 60 डेज का प्लान बता रहा हूं, मिनिमम हम 15 to 30 ग्रैंड टेस्ट देंगे ही देंगे, which comes out to be around 1 to 2 tests per week. So in if you see my schedule, if you see the schedule which I have made for myself, इस schedule के अंदर you can see every time I have put some mock test, I have put some mock test. तो every week I have placed these mock tests and these time tests, और ये timed test in a certain time 200 क्वेश्चन लिए, 300 क्वेश्चन लिए, उनको अपने आप को चैलेंज किया that I will do it in next 60 minutes, I'll do it in next 90 minutes. इस तरह से you have to challenge yourself and you have to move ahead. Don't like I would use the word waste your time on studying the notes again, because notes are basically to help you understand a concept. But exam के अंदर you are going to get MCQs only, and that is what is going to define what you are going to do. So all your dreams beta can come true if you have the courage to pursue them. ये NB ही है, Government of India, National Board है, whatever it is, it may delay the exam, it may do whatever it wants to do, but if you have defined your destiny, अगर आपने सोच लिया है कि मैंने ये करना है, तो करना है तो करना ही होगा. ये हिंदी में एक छोटा सा पोएम है, आई जस्ट से इट टू यू विद इन फ्यू सेकेंड्स. लोहा जितना तपता है, आई थिंक यू मस्ट हैव हर्ड अबाउट इट, बट दिस इज जस्ट टू हेल्प यू गेट मोटिवेटेड एंड गेट स्टार्टेड. लोहा जितना तपता है उतनी ही ताकत भरता है, सोने को जितनी आग लगे वो उतना प्रखर निकलता है, हीरे पर जितनी धार लगे वो उतना खूब चमकता है, मिट्टी का बर्तन पकता है पर धुन पर खूब खनकता है, सूरज जैसा बनना है तो सूरज जितना जलना होगा, नदियों सा आदर पाना है तो पर्वत छोड़ निकलना होगा। सो मेक श्योर कि आप हर एक संकट में का हल होगा, वो आज नहीं तो कल होगा। यू हैव टू मेक श्योर दैट whatever motivation level you have to increase that motivation level, and ये 2 महीने में you have to stay very focused. So anyways, let's go ahead and general basic community medicine ke I have prepared some few high yield points and special topics which may be asked frequently in your exam, and let's go ahead and try to solve those special topics. First MCQ is beta, COVID screening at the airport is what level? What level of prevention? What do you think? Mass strategy, high risk strategy, primordial prevention, primary prevention? This topic is from levels of prevention. Levels of prevention. So क्या बोलते हो? What is the level of prevention? कहाँ पे होगा? क्या होगा? So if you just see, look at the levels of prevention. We have done this a lot of times in the videos, in the classes, and many places. Levels of prevention can broadly be categorized into these 4 levels: primordial, primary, secondary, and tertiary. So make sure ke exam mein, when you are attempting the exam, you should be able to find out what you are preventing. So what you are preventing in primordial, you are preventing the risk factors. In primary, you are preventing the disease. In secondary, you are preventing the complication, the person has disease. Very frequently students get confused between primary and secondary. In tertiary, you are going to prevent the complications. If you understand this, COVID screening at the airport, what level of prevention? Please note that COVID screening at the airport is a level of primary prevention. Why do we say primary prevention? Because the main motive is not to prevent the risk factor, it is to prevent the disease in the general population. It is not to find disease and prevent complication in that person, it is to prevent that person entering into the population, because the population is already at risk. So COVID screening at the airport is a level of primary prevention. You are going to get a question on this. This is very ultra high important. I think you should also be remembering, what is this prospective screening? What do you mean by prescriptive screening? Prospective screening is what we also called as the presumptive screening. Examples for this would be HIV screening in pregnant females, HIV screening for blood donation, COVID screening at airports, and pre-employment medical checkup. Prescriptive screening is essentially a type of secondary level of prevention, and इसमें आ जाते हैं all your examples like visual inspection with acetic acid. This is one of the screening test of choice for cervical cancers. Then you have pap smears, which are of course the diagnostic tests, mammography for breast cancers, fasting blood glucose, HbA1c. All these are termed under secondary level of prevention. These are prescriptive screening, whereas the presumptive screening, these are primary levels of prevention. So also many times in your exam you get MCQs like what are the examples for these levels of prevention. So if you just look at what is the primordial prevention, primary, secondary, and tertiary. Primordial prevention examples would be health education, health promotion, lifestyle modification. Primary prevention beta, vaccines, immunization, any type of vaccines. Confuse nahi hona. Yellow fever vaccine, measles vaccine, rabies vaccine, pre-exposure prophylaxis, post-exposure prophylaxis, all are types of primary prevention. Do not get confused. Any type of vaccine is a primary prevention. Immunizations, prophylaxis, any type of chemo prophylaxis, doxycycline for malaria, rifampicin for leprosy, presumptive screenings, all are examples of primary level of prevention. Secondary prevention example is early diagnosis and treatment. Tertiary prevention is disability limitation, rehabilitation, transplant surgery, and prosthesis. So this question is a very 5-star MCQ. Make sure that you study all the levels of prevention and go for your exam. Going to the next point, the following indices are used for measuring morbidity and disability except. The question is all about except. So make sure आप इसको ध्यान से attempt करें. Disability या morbidity indicators all are true except. So Sullivan's method, Hale, Daly, PQLI. Out of these indicators, I think काफी आपने students ने सुना होगा about these indicators. A very quick review. I think everybody must have got the answer also. Very quick, you should remember what is Daly, what is Hale, what is Colley, what is PQLI. Beta, Dale stands for Daly stands for disability adjusted life years. Delhi में दो चीजें होती हैं. It contains years lost to life and it also contains years lost to disability. That is premature deaths and numbers years with lived with disability. ये जो दोनों चीजें हैं ये बताती हैं these Delhi is the best indicator for burden of disease. Next question में आ सकता है what is HAIL? HAIL stands for Health Adjusted Life Expectancy. It is a very good indicator for healthy life expectancy. ये बताता है कि population की health कैसी है. So what is HAIL? HAIL is the number of years that we live with without disability or free from disability. What is QALY? QALY stands for Quality Adjusted Life Years. It is the number of quality life years which are gained with intervention. QALY को याद रखना है. It is the measure. This is a frequently asked MCQ. It is a measure of effectivity of an intervention. इसी ऑप्शन में what was PQLI? बेटा PQLI is not a measure of disability. PQLI is a measure of life expectancy at 1 year of age with literacy rate and infant mortality rates. PQLI is an indicator of quality of life. ये पुराना indicator है, ये अब इतना ज़्यादा पूछा नहीं जाता, but still for your exams you should know what is PQLI. Next is there also have been questions like what is HDI? HDI beta, it stands for Human Development Index. Human Development Index, इसके अंदर there are 4 small indicators in 3 dimensions. What are the 4 indicators? It takes into account the life expectancy at birth, mean school years, expected school years, and gross national income per capita. ध्यान देंगे, it is important for us to understand that it does not include the gross domestic product, it includes the GNI, gross national income per capita. It is the best indicator for overall development of the country. So make sure you get your these questions right. So what is the best answer over here? The following indices are used to measure disability or morbidity except. So Sullivan's method. What is Sullivan's method? Sullivan method is used. It is a method used to calculate the healthy life expectancy. जो Sullivan method है, it is used to calculate the healthy life. It's just a method. So ये बताता है somewhat like how to calculate the HAIL. So Sullivan, HAIL and Daly ये तीनों, they are all three used for measuring disability. PQLI is not used for disability and that is the reason it is our best answer. Next question आता है match the following. So I would give you like 2 seconds, 3 seconds. Just read the question and try to match the following. Very easy question. It is again a 7-star MCQ topic. So just have a look at this question. What do you think this is? This is primary case, case fatality rate, generation time, serial interval, incubation period. What do you think? Primary case, it matches with what? Primary case. So इसमें match the following करना है. And if you just see these definitions, very easy definitions. Primary case, what do you mean by a primary case, beta? Primary case is the first case in the community. Primary case is the first case in the community. What is case fatality rate? Case fatality rate is related to the virulence factor of the infectious disease. What is case fatality rate? ये भी कई दफा पूछा जाता है. Case fatality rate is nothing but the number of deaths due to a certain disease divided by the number of cases of the same disease multiplied by 100. Case fatality rate, please remember, it does not account for time. Case fatality rate does not account for time. It is related to the killing power or the virulence, and it is the number of deaths due to a certain disease divided by total number of cases of the same disease. So make sure you get this question right about case fatality rate. What is generation time? Generation time is the time between the entry of the microbiological agent or the infectious agent and the maximum communicability of the host. That is what is generation time. But this has been asked like multiple times. What is the use of generation time? Generation time ये बताता है कि कितनी देर तक infectious agent will be infectious. So it tells us about the infectious time period. What is serial interval? Serial interval is the time between the first case, the primary case, and the secondary cases. What is incubation period? Incubation period is the time between the entry of organism and the first sign and symptom. It is the time period between the entry of organism and first sign and symptom. It is used for quarantine periods. That is what is this incubation period. It is used for quarantine. Quarantine क्या होता है? Quarantine is done for healthy people and it is done for maximum incubation period. Generally, it is done for 2 times the incubation period, but usually, like technical word is, it is done for maximum incubation period. That is what is quarantine period. So that is the like match the following. Primary case is the first case, so A would be equal to number 5. A would go with 5. Case fatality rate is the case fatality rate. B goes with 1. It is related to the virulence of the infectious agent, so B goes with 1. Generation time is related to the maximum communicability of the host, that is C goes with 4. And then you have serial interval, that is D goes with 2. And incubation period is used for quarantine period, E goes with 3. So that is what is this match the following. Next is a few questions coming from epidemiology. In a study to assess the effect of smoking on atrial fibrillation, patients with atrial fibrillation and without atrial fibrillation were taken from a cardiac care hospital and smoking habits were evaluated in each. ये आपको क्या लगता है? What type of study is this? So take a small notebook and try to write the answers over here and try to attempt this MCQ. मैं तो बता ही दूंगा. You also try to attempt this MCQ. Read the question again and try solving it before I tell you right now. So, in a study to assess the effect of smoking on atrial fibrillation, patients with atrial fibrillation and patients without atrial fibrillation, इन दोनों patient groups को लिया and smoking habits were evaluated in each. So, what do you think? ये क्या है? Prospective cohort study, case control, nested case control या experimental? Please note that you had taken patients with atrial fibrillation and patients without atrial fibrillation. You are taking cases and you are taking controls and उनसे हम smoking की history पूछते हैं. This is a clear-cut example of a case control study. This is not a cohort study. It is not experimental design. Very frequently आपको इसके ऊपर questions आते हैं. What do you mean by what do you mean by a cross-sectional study, ecological study, case control study, and what is a cohort study? So what is cross sectional study? Cross sectional study is nothing but the snapshot of the population. It is based on individual level. Total population में आप शुरू करते हैं. This has been taken as testing concept hundreds of times. This is the most important 5-star point, that in cross section study you start with total population and you calculate the prevalence. Ecological study, please note that the study unit is what is population. Ecological study mein the unit is population, and what do you do in ecological study? You correlate the variables. It is also called as correlational study. You correlate the variables. इसमें एक special bias आता है, ये भी काफी पूछा हुआ है. What is ecological fallacy? Coming over to the favorite MCQs from case control and cohort, salient points you would like to remember for case control. Case control study, you start with what? You start with disease, non-disease, and because of disease se shuru karte hain, these studies are also called as retrospective study. In case control study, you calculate the odds ratio. You have a special bias that is called as the recall bias, and please note this has been asked multiple times that in a case control study, because you start with people with disease and without disease, in logon mein aap risk factor assess kar sakte hain. So therefore, multiple risk factors can be assessed. Whereas on the other side, if you look at the cohort study, अगर आप cohort studies को देखते हैं, you start with people with risk factors. You start with people with risk factors, and then you keep on following them. And because you can follow them, you can see multiple outcomes. So इसमें गलती नहीं होनी चाहिए. Multiple risk factors are studied in case control study. Multiple outcomes are studied in cohort studies. Case control studies, these are usually used for rare disease. Why? Because you're starting with people with disease and non-disease. And cohort studies, you are starting with risk factors. You can assess the rare risk factors, which is more time taking. Cohort studies, which is less time taking, that is case control study. So it's a very simple direct MCQs that what is the study design? This study design is, as we have seen, this is a case control study design. This is again a 7-star MCQ topic. Every year you get questions from these epidemiological study designs. Coming over to the next MCQ, A total of 300 newly diagnosed patients with COVID are allocated to treatment with either steroids alone or steroids and remdesivir. What is this study design? What do you think? सो इसमें 300 आपने पेशेंट्स लिए विद कोविड एंड एक ग्रुप को दिया स्टीरॉयड, दूसरे ग्रुप को दिया स्टीरॉइड्स एंड रेमडेसिविर. सो व्हाट इज दिस स्टडी डिजाइन? दिस स्टडी इज नॉट अ केस सीरीज. It is not a case control. It is not a cohort study because it is not, you are not starting with the risk factor and following the disease hua ke nahi hua. You are simply taking people with disease and you're giving treatment A to one group and treatment B to another group. Yahi kar rahe ho. So what is this study design? This study design is a simple answer. It is a clinical trial. Please note, ye काफी दफा पूछा हुआ है, what is randomization? What do you mean by randomization? This is a 3-star MCQ. What do you mean by randomization? Randomization, it removes what bias? ये बताओ मेरे को, randomization removes what bias? It removes selection bias. Randomization removes selection bias. And it is done at what level? Is it done at the level of selection? Answer is no. It is not done at the level of selection. It is done at the level of allocation. This was asked in your FMGE exam, I think 2019 MCQ, that randomization is done at what level? Is it done at the selection? Answer is no, it is done at level of allocation. So इसको गलती से भी भूलना नहीं है. It is done at the level of allocation. What is randomization? Randomization. This is a distinction level MCQ. Randomization होता क्या है? What is it? Is it a known chance or unknown? Equal or unequal? Please remember, it is a known chance and equal chance. ये तीन बातें याद कर लो. Randomization, and if you understand what is clinical trials, and if you remember what is case control, cross sectional, ecological and cohort studies, आपका एपिडेमियोलॉजी में क्वेश्चन इज गारंटीड. ये टॉपिक कहीं नहीं गया और ये हर साल पूछा जाता है. दिस इज गारंटी टॉपिक एंड मेक श्योर यू गेट इट राइट. नेक्स्ट एमसीक्यू देखते हैं. कैलकुलेट द रिस्क रेशियो फॉर अ कोहॉर्ट स्टडी वेयर द इंसिडेंस ऑफ द एक्सपोज्ड group is found to be 10 whereas the incidence in the non exposed is found to be 4. ये कह क्या रहे हैं, हो क्या रहा है यहाँ पे? I think everybody knows what is relative risk. बेटा मैं बता दूं, relative risk रेशियो का दूसरा नाम है. Relative risk is also called as risk ratio. अब आया दिमाग में, what is relative risk? Relative risk कहाँ पे calculate करते हैं? Relative risk you calculate in cohort studies. In cohort studies, what do you calculate? You calculate the relative risk. In case control studies, what do you calculate? In case control studies, we calculate the odds ratio. What is the formula for relative risk? Relative risk is given by the formula incidence in exposed group divided by incidence in the non-exposed group. Incidence in the exposed group divided by incidence in the non-exposed group. That is the formula for relative risk. And what is odds ratio? Odds ratio is also known as a cross product ratio, and cross product ratio is given by the formula A into D over B into C. It is done only in case control study. That is what is odds ratio. So यहाँ पे सवाल क्या पूछ रहा है? यहाँ पे सवाल पूछ रहा है कैलकुलेट द रिलेटिव रिस्क. रिलेटिव रिस्क इज इंसिडेंस इन द एक्सपोज्ड या रिस्क इन द एक्सपोज्ड डिवाइडेड बाय रिस्क इन द नॉन एक्सपोज्ड. तो रिस्क इन एक्सपोज्ड कितना है वो मैं रेड कलर से लिख रहा हूँ 10, एंड रिस्क इन नॉन एक्सपोज्ड मैं ग्रीन से लिख रहा हूँ, दैट इज 4. So what is it? Simple answer यार, इसमें कुछ दिमाग नहीं लगना. 10 divided by 4. So what is the formula? Calculator चाहिए तो कर लो use. 10 divided by 4. What is the answer? It is 2.5. It's a very direct, you don't need any calculator for this. It's a very direct type of MCQ. Calculate the relative risk. This has been asked multiple times. Make sure you get these questions right. कुछ क्वेश्चंस देखते हैं फ्रॉम वैक्सीन्स एंड इम्यूनाइजेशन. अनदर वेरी हाई यील्ड टॉपिक, वेरी फ्रीक्वेंटली आस्क्ड इन योर एग्जाम. होता क्या है वैक्सीन्स में, क्या क्या क्वेश्चंस आ सकते हैं? पहला सवाल, यू शुड नो पोलियो इज द टॉक ऑफ द टाउन. यू शुड नो एवरीथिंग इन एंड अबाउट पोलियो. पोलियो क्यों इतना जरूरी है? बिकॉज कंट्री इंडिया में अभी पोलियो केसेस नहीं है, काफी जगह पे वापस रिसर्जेंस वी हैव सीन फॉर पोलियो. सो पोलियो मे बी आस्क्ड इन योर एग्जाम. मेक श्योर यू गेट दोस क्वेश्चंस राइट. इसको बिल्कुल अच्छी तरह पढ़ के जाना है एंड मेक श्योर कि हम ये एंड मेक श्योर कि हम ये सारे क्वेश्चंस जो जो मैं आपको टॉपिक्स बता रहा हूँ, ये टॉपिक्स की लिस्ट बना लो. ये लिस्ट के हिसाब से यू शुड डू. यस आई नो अबाउट पोलियो, यस आई नो अबाउट केस कंट्रोल स्टडीज, यस आई नो अबाउट डिसेबिलिटी इंडिकेटर्स. ये सारे टॉपिक्स को टक 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 करके जरूर मेक श्योर दैट यू स्टडी फ्रॉम योर नोट्स, यू स्टडी फ्रॉम व्हाटएवर सोर्स यू हैव, बट मेक श्योर यू गेट योर क्वेश्चंस राइट, बिकॉज दैट इज व्हाट आई एट द एंड ऑफ द डे आई वांट. बेटा प्लीज रिमेंबर के कहा जाता है कुछ देर की खामोशी है फिर शोर आएगा, तुम्हारा तो वक़्त आया है, हमारा तो दौर आएगा। सो मेक श्योर यू गेट ऑल योर स्पिरिट्स हाई अप एंड आप इसको ठीक तरीके से पढ़ते हो। Polio is one disease which is very important for your exam. All of the following are true regarding oral polio vaccine except produce both humoral and intestinal immunity. Live attenuated vaccine not effective in combating epidemics, unstable at high temperature and light. So all are true except ये except वाला क्वेश्चन है, इसमें गलत वाली बात बतानी है। क्या लगता है आपको कौन सा ऑप्शन गलत है? If you look at what is oral polio vaccine and what is inactivated polio vaccine, जिसको आप प्यार से IPV कहते हैं, OPV कहते हैं, oral polio vaccine. OPV was made by Dr. Sabin. It is by the Sabin strain. Salk is what is inactivated. You can remember it is killed. So ये याद रखें K for killed, K for Salk. Oral polio vaccine, it is live attenuated, whereas Salk is the killed. And OPV, it produces both local and humoral. Humoral क्या होता है? Humoral means the blood immunity, the immunoglobulins. So it produces both the local and the humoral immunity, whereas the inactivated polio vaccine, it produces only the humoral immunity because ये local नहीं ना, intestine में नहीं ना देंगे. Inactivated is given as injectable vaccine. It is given either as intradermal दोगे या फिर आप देंगे intramuscular. So OPV can also be used in epidemics, whereas the IPV cannot be used in epidemics. OPV का एक side effect है that it may cause vaccine associated paralytic polio, whereas there is nothing, no side effect of the inactivated polio vaccine. In India, we are giving a bivalent OPV. Please remember, in India, we are giving a bivalent OPV, whereas in uh, uh, in IPV, we are giving something called as the fractional IPV. What is fractional IPV? That is the intradermal route. इंडिया में हम इंट्रामस्कुलर रूट नहीं देते, इंडिया में हमारा इंट्राडर्मल रूट चलता है for the inactivated polio vaccine, whereas oral polio vaccine is oral and it is given bivalent. What are the strains we are using in the bivalent polio vaccine? We are using P1 and P3. P2 strain नहीं देते. Why? Because P2 may lead to mutations. दो चार बातें about polio vaccines and about poliomyelitis. Please remember that what is the side effect of polio? Please remember that what is the side effect of polio? Side effect of OPV is what is VAP, that is vaccine associated paralytic polio. Long term use of trivalent OPV may lead to mutations and this causes VDPVs. When do we have National Switch Day? 25th April 2016. When was India declared free from polio? 27th March 2014. When was the global eradication of the wild polio virus 2? When was it declared? It was declared on 20th of September 2015. ये तीन dates हैं, ये आपको by heart याद होने चाहिए. Very frequently they have already asked you when do we have the National Switch Day. A few questions on the National Polio Program. AFP surveillance में बेटा we collect stool samples. Both the stool sample they should be collected. The first stool sample should be collected within how many hours? Within 48 hours of the AFP reporting, and both the second sample should also be collected within 14 days, but at least with a gap of 24 hours. It should be collected within 14 days, but with a gap of 24 hours from the first sample, and then you do residual paralysis check after 60 days of AFP reporting, and that is what is AFP surveillance. Coming back to the question, all of the following are true regarding the oral polio vaccine. So which is false? All are true except is not effective. It is effective in combating epidemics. This is the wrong answer. It is effective in combating epidemics. So make sure you get these questions right. Next MCQ देखते हैं. As a part of national immunization schedule, the fractional inactivated polio vaccine is given as. So again, a small question on polio. I told you polio is very important, so make sure you study it right and go. So as a part of the national immunization schedule, the fractional IPV is given as. When do we give it? बर्थ पे देते हैं 6 हफ्ते पे, 10 हफ्ते पे, 14 वीक्स या 9 मंथ्स पे. So what do you think the correct answer would be? So 1 and 5, 2 and 4, 1 only या 2, 3 and 4 all are correct. So क्या लगता है आपको? When do we give fractional IPV? So if you look at the national immunization schedule, if you look at this national immunization schedule, beta, national immunization schedule at birth we are giving some vaccines. ये जो schedule है ये आपको पूरा अच्छी तरह याद हो जाना चाहिए. at 6, 10, 14 weeks, what are the vaccines we are giving? 9 months, 16, 24 months, 5 to 6 years. So as you can see, when do we give the fractional IPV? The fractional IPV is given at 6 weeks. It is also given at 14 weeks. ये भी काफी दफा पूछा गया है कि ये कहाँ कहाँ दी जाती है. याद रखें कि लेफ्ट अपर आर्म पे दो वैक्सीन होंगी, वन सबक्यूटेनियस, वन इंट्राडर्मल. विच इज द सबक्यूटेनियस? Japanese encephalitis vaccine. Which is the intradermal vaccine? Intradermal on the left side is BCG. Right hand pe again one subcutaneous, one intradermal. Left may be one subcutaneous, one intradermal. Right may be one subcutaneous, one intradermal. Which is the subcutaneous? That is measles rubella. Which is the intradermal? That is fractional IPV. Next is right thigh. Right thigh pe which vaccine are we giving? We are giving only one vaccine, that is pneumococcal conjugate vaccine. And on the left thigh we are giving pentavalent या फिर hepatitis B, and or we are also giving the DPT vaccine. So DPT is only given at certain age groups. DPT is only given as the booster ones, and make sure you get this question right. So if you have understood this, as a part of the national immunization schedule, the fractional polio vaccine is given as, when do we give it? It is given at 2 times. It is given at 6 weeks and also given at 14 weeks. So which one is correct? It is option number B, that is 2 and 4 are the correct answers. नेक्स्ट एमसीक्यू देखते हैं, विच ऑफ द फॉलोइंग इज नॉट अंडर ओपन वायल पॉलिसी. ये अलग ही सवाल होता है, ये कोल्ड चेन के ऊपर बहुत दफा पूछा जाता है. दो चार बातें आपको याद कराऊं अबाउट कोल्ड चेन. कोल्ड चेन पहला सवाल आता है, व्हाट इज द टेम्परेचर वी हैव इन अ कोल्ड चेन? व्हाट इज द टेम्परेचर? 2 to 8 डिग्री सेल्सियस. देन कोल्ड चेन में ना एक चीज होती है जिसको हम कहते हैं ILR. व्हाट इज ILR? आइस लाइंड रेफ्रिजरेटर. प्लीज नोट दैट द आइस लाइंड रेफ्रिजरेटर, this ice-lined refrigerator, it needs how much electricity? It needs 8 hours of electricity in 24 hours to maintain the temperature for 24 hours. Minimum 8 hours of continuous electricity isko chahiye to maintain for 24 hours. ILR jo hota hai, if you look at an ILR, it looks like this. Ice-lined refrigerator. In the ILR, which vaccines are kept in the center compartment? Please note that in the central area, please note that in the central area, it is always the TT vaccine or the TD vaccines. These are kept in the center. Which vaccines are kept in the lower part? Lower part where we have the oral polio vaccine and we have the measles vaccine. Which vaccines are always kept in the upper zone? That is hepatitis B and the pentavalent vaccine and the hepatitis B vaccine. Please also remember that ILR में placement has been asked multiple times. This is a 4-star MCQ topic. ILR में what forms the cover of ILR? मतलब vaccines तो हैं, but what is the top of the vaccine? It is always diluents. So what is diluents? They are the first thing that you keep. Always you keep the cover of the vaccine as diluents. So placement of vaccines has been asked multiple times. Next आता है, what vaccines, opened vials of which vaccines are not to be kept back in the ILR? ये मतलब होता है ओपन वायल पॉलिसी का. दैट मींस इफ यू ओपन अ वायल, you should discard it within how many days? 28 days. But which vaccines should never be kept back? That means they are not under open vial policy. So you can remember Mera, Rota, Bichara, Jija. So that's a funny way of remembering it, but that's how मैंने ऐसे याद किया. MR stands for measles rubella, Rota is rotavirus, BCG is BCG, JE is for Japanese encephalitis. Plus we also have for COVID-19. So Mera, Rota, Bichara, Jija, you can just easily remember these vaccines are not under open vial policy. एक दफा ये खुल गई, इनको वापस ILR में नहीं रखा जाता. So which of the following is not under open vial policy? So इसमें JE vaccine is not under open vial policy. Measles rubella is not under open vial policy. Both these vaccines, A and B, इसमें दोनों आंसर करेक्ट हैं. These both vaccines are not under open vial policy, whereas pentavalent and oral polio vaccine, once you open it, if the temperature is maintained, you keep them for how many days? 28 days. अगर इसका vaccine vial monitor patent है और वो normal है. Coming to the next MCQ, which of the following is not a preferred vaccine for unimmunized child presenting at 18 months of age? अब सवाल आता है, बच्चे को टीकाकरण नहीं हुआ, 18 महीने तक, 1.5 year तक बच्चा is, the child is unimmunized. So what do you think, which of the following is not a preferred vaccine? Not a preferred vaccine. Options are measles, rubella, DPT, pneumococcal, OPV. But please remember that if a child is coming at 18 months of age, that is 1.5 years of age, and अगर बच्चे को वैक्सीन नहीं लगा, you should always by heart remember maximum age group, कब तक हम क्या क्या वैक्सीन दे सकते हैं. These are vaccines that you should be remembering for your exam. These are points you should be remembering for your exam. So at birth we are giving hepatitis B. Hepatitis B we can give it till 24 hours. OPV can be given till 5 years. Measles, rubella can be given till 5 years. DPT is one vaccine which can be given till 7 years. Japanese encephalitis can be given till 15 years. ये direct याद करना है. Very frequently you get question कि pentavalent rotavirus vaccine, pneumococcal vaccine, IPV vaccines can be given till what year of age? They can only be given till 1 year. If you have given the first dose within 1 year, then you give the remaining dose. But अगर आपने सारी first dose first year के अंदर नहीं दी, then you do not start them. So if you have started, then you finish. But if you have not started, then you don't start after 1 year of age. Am I clear on this? BCG can be given till 1 year. ये भी कई दफा पूछा जाता है बीसीजी की डोज क्या है. प्लीज नोट 0 to 1 month अगर एज ग्रुप है, डोज इज 0.05 ml. if the age is after 1 month, it is 0.1 ml. It is given as intradermal injections. Make sure you study this. But ये सिर्फ 0 to 1 month of age 0.05 ml ये सिर्फ इंडिया में ही है. until and unless MCQ में लिखा हो that what is the dose of BCG till 1 month of age, then you answer 0.05. Otherwise, keep it simple. Mark the best answer, that is dose is 0.1 ml for BCG. So what is the answer for this? Which of the following is not a preferred vaccine? Measles, rubella can be given till 5 years. So yes, ये जाएगा. DPT can be given till 7 years. Yes, ये जाएगा. Pneumococcal vaccine can be given only till 1 year. This is not to be given. OPV can be given till 5 years. Yes, ये जरूर जाएगा. So the best possible answer over here is pneumococcal vaccine. Incovac has been recently developed for COVID-19 and it is a type of what vaccine? What do you think Incovac is? So please note that Incovac has been recently developed for COVID-19 and it is a type of a recombinant replication defective vaccine. So Incovac, Government of India is very proud to say that Incovac has been recently approved for use, emergency use for COVID-19 in India. Incovac is the only nasal vaccine. इसका जो strain है that is BB154-154V strain है. And this has been produced in India by Bharat Biotech and Incovac has been given approval for use. It is a recombinant replication defective type of vaccine. Please note that बहुत सारी types of vaccine हो सकती हैं. We can have protein subunit vaccine, virus-like particles, DNA-based RNA, non-replicating, replicating. COVID के अंदर maximum vaccines they are non-replicating type of viral vaccines. We can use adenoviruses, we can use pox viruses. MCQ एग्जाम के लिए याद रखें कि कौन सी vaccines हम ज्यादा यूज कर रहे हैं. In most parts of the world India के नहीं, world में we are using mRNA vaccines, non-replicating viral vector vaccines. These have been most commonly used. Examples for RNA vaccines and non-replicating viral vector vaccine examples could be AstraZeneca vaccine, Covishield, J&J, that is Johnson Johnson, Gamaleya Institute, Incovac. All these are type of non-replicating viral vector vaccine. The mRNA vaccine, which is again very commonly used, is Pfizer by the Pfizer company and by the Moderna. एक होती है that is inactivated vaccine. Inactivated vaccine has also been developed and we also have the protein subunit vaccine. ये भी कम नहीं है, but yes, these are the broad 4 categories of the COVID vaccines which have been abundantly used in the world. And these are like protein subunit vaccine, that is Novavax and Corbevax. Beta, Corbevax is a receptor domain binding protein vaccine. And ye Corbevax is also produced in India and it has been manufactured in India, and Corbevax has been approved for COVID-19 in India. Inactivated vaccine, I think everybody knows about Covaxin, killed vaccine होती है. ये 4 types of vaccines, 5-star MCQ, frequently asked in your exams in the last 1 or 2 years, ये भी आ सकता है. Coming over to the next topic, like what are the MCQs we might think we get from biostats. Very simple topic, इसके टॉपिक के ऊपर ज्यादा जोर नहीं देना, ज्यादा दिमाग नहीं लगाना, बहुत सिंपल इजी टॉपिक है. डायग्राम्स के ऊपर, ग्राफ्स के ऊपर मैक्सिमम क्वेश्चन आते हैं. सो व्हाट इज दिस बार डायग्राम? बार को किसके साथ कंपेयर करोगे? Please note that whatever diagrams they may ask you for quantitative data, okay? Quantitative data. What are quantitative data? Quantitative data is that data which is usually measurable, and the quantitative data is that data which is usually continuous. So, example, the graphical type for quantitative data we can use is histograms, or we can use frequency polygon. For qualitative data, we can have bar charts or pie charts. Please remember, ये frequently asked question है for technical data. I think this was your repeat questions from FMGE 2020. For technical data, like you want to teach what are the causes of IMR, you want to teach what are the neonatal mortality causes, you want to teach what are the uses of ORS, components of ORS, you can always use pie charts. Pie chart is always in percentages. For mass awareness, what is the graphical presentation we use? We always use pictographs. Location of variable के लिए spot maps होते हैं. Intensity of disease के लिए we have core pleth maps. Correlation can be drawn by scatter plots. Distribution of variable is by box and whisker. Box and whisker has been a 3-star MCQ frequently asked in your exam. What is a box and whisker? If you look at the box and whisker, this is what is the box and this is what is the whisker. It is dividing the data into quartiles. Each whisker में कितना percent population lie करेगा बेटा? Each whisker is 25%, 25%, and box के अंदर कितना total population होगा? Total box is 50% of the population. And where does the median lie? The median lies in the center. The interquartile range, what is interquartile range? That is the difference between the Q3, that is the upper quartile, and the lower quartile, that is Q1. Matlab box ka width is what is called as interquartile range. So make sure that you study these topics. These are the only topics which you will get in biostats, and ye graphical presentation पढ़ के जरूर जाना. Time trend is given by time trend charts, that is the disease trend over time. So if you understand this topic, this graphical presentation, this question is super duper easy. Bar diagram is for which type of data? It is for discrete data. Why discrete data? Because what is discrete data? That is what is a qualitative data. That is what is a qualitative data. Just a second, guys. Yeah. Next coming over is what is frequency polygon. Beta, please remember that frequency polygon, that is frequency polygon is for continuous data. Just now we did. What do you mean by frequency polygon? Frequency polygon is formed by joining the midpoints of a histogram. Last is, and a third point is, so frequency polygon is continuous. Line diagram. What is line diagram? Line diagram abhi humne kiya tha. That is for trend of events, and scatter plot is for correlation of the data. So there's a very super duper easy MCQ. What are the graphical presentations? And make sure you get this question right. Which of the following statement is incorrect about standard normal distribution? Sorry for my cough. I've got a bad throat. I think everybody is getting that. So I had been sick for last few days. You can say 1 or 2 days. So anyways, which of the following statement is incorrect for about the standard normal distribution? So what is incorrect? इसमें गलत बात कौन सी है about the normal distribution? It shows a bathtub distribution. It has mean equal to 0. What do you think? It has mean equal to 0. It is bilaterally symmetrical. Bell-shaped curve has variance equal to 1. क्या लगता है आपको? Which is incorrect. So ये काफी दफा पूछा हुआ है. It's a standard question that what is a normal distribution curve? But a normal distribution curve is a curve which something looks like this. Normal distribution curve, I'll give you one slide. इस slide में you are bound to get at least one MCQ. So आपका ये 5-star point है. ये 5-star एक slide के अंदर एक question आपका जुड़ा हुआ है. So what is Gaussian distribution? It is also called as the normal distribution curve. Is also called as the Gaussian distribution. Gaussian distribution में the center of the curve If this is the normal distribution, the center of the curve, that is the mean, that is also the median, that is also the mode. And is point pe, what can you tell me, what is the standard deviation? Please remember that at this junction the standard deviation will be equal to 0. And that's the reason we sometimes say that the mean, median, mode, they all lie at 0 point. What is 0 point? That is the standard deviation is 0. Then you have plus 1 SD, plus 2, plus 3, minus 1, minus 2, and minus 3, minus 3, minus 2, minus 1, plus 1, plus 2, and plus 3 standard deviation. How much population lies within plus minus 1 SD? Within plus minus 1 SD, 68%. Within plus minus 2 SD is 95%, and within plus minus 3 is 99% of the population. ये भूलना नहीं है. So क्या चार बातें याद रखनी है? What is Gaussian distribution? Normal distribution, the ends never touch the baseline. It is a bilaterally symmetrical bell-shaped curve. Within plus minus 1 SD, 68, 95, within plus minus 2, and 99 within plus minus 3. ये पांच बातें याद रख लो. Gaussian distribution पे एक और क्वेश्चन आपका डाउन हो जाएगा. Next MCQ. So I think which of the following is incorrect? इसका आंसर तो देखें. Which of the following is incorrect about standard normal distribution? So it shows a bathtub distribution. Bathtub तो बेटा ऐसा होता है ना. That is how the bathtub is. So this is a false option. This is the wrong option. Has mean equal to 0. Bilaterally symmetrical bell-shaped curve. Has variance equal to 1. Variance क्या होता है? You already know that standard deviation कोई चीज होती है. Standard deviation को अगर आप square कर दें, that is called as variance. ये क्या बताता है? ये बताता है कि कितनी वेरिएशन है डेटा में. सो जब आप आगे बड़े एग्जाम्स दोगे, पीजी एंट्रेंस के एग्जाम्स दोगे या INI सेट दोगे, at that time you'll need more of understanding like what is variations, what is variance, what is standard deviations, what is mean deviations. But at this level, just remember what is standard deviation. Standard deviation is the deviation, mean deviation from the center point. And if you square that standard deviation, that is called as variance. Okay, so make sure you get this done. Next question देखते हैं. Which of the following factor is a good factor for a good screening test? Please remember that beta that you have something called as sensitivity, specificity, reliability, predictive values, and positive predictive value and negative predictive value. जब भी स्क्रीनिंग की बात आए, okay, make sure you get this concept right. जब भी स्क्रीनिंग की बात आए, you will use sensitivity. क्या यूज करेंगे? सेंसिटिविटी. एंड इफ द क्वेश्चन टॉक्स अबाउट डायग्नोस्टिक टेस्ट तो क्या यूज करेंगे? स्पेसिफिसिटी. ओके, पहला तो यही क्वेश्चन है. वेरी सिंपल. क्वेश्चन नंबर 2, व्हाट इज अ मोर सीरियस एरर? मोर सीरियस एरर कौन सा होता है? Is it a false positive error or a false negative error? Beta, I think you all remember it is a false positive error which is more serious than false negative error. Next point. What is predictive value? Predictive value, that is the positive predictive value. Predictive value could be positive, it could be negative, right? So predictive values, you are specifically talking positive predictive value. They tell you what? They are also called as the diagnostic accuracy for a test. They tell you like if the test is positive, agar test positive hai, what are the chances that the patient actually has disease? That is what is the diagnostic accuracy. Diagnostic accuracy is not given by the sensitivity specificity, it is given by the positive predictive value. What is reliability? Reliability means getting the same results again and again. Isko kehte hain repetitive value. That is, you're getting the same results again and again and again. That is what is reliability. Okay, so please get these topics right. What is sensitivity, specificity, what is predictive value positive, what is predictive value negative, and what is reliability. So question आया था, most important factor for a test to be good screening test क्या लिखता है? So good screening test बताया तो है अभी. What is the best answer? It is sensitivity. Next question को देखते हो, थोड़ा और समझ आएगा. Probability of having disease if the investigation result is positive is known as. So probability of having disease, बीमारी होने की संभावना, if the investigation is positive, अगर टेस्ट का रिपोर्ट पॉजिटिव आया, आपको मेरे को कफ एंड कोल्ड है, अगर मैंने कोविड टेस्ट अभी किया और कोविड टेस्ट बाय चांस पॉजिटिव आ गया, so what are the chances that the COVID test is positive and I really have COVID? So what are the chances? So that funda will be given by the investigation जो मैंने COVID test किया अभी, the investigation of that test, the investigation का positive predictive value क्या है? This funda, if the test is positive, what are the chances that the patient really has disease? अगर test positive आया तो उसको बीमारी होने की क्या संभावना है? That is given by positive predictive value. So make sure you get this right. This is what is the positive predictive value, that the probability of having disease if the investigation is positive is called as positive predictive value. कुछ क्वेश्चंस देखते हैं अबाउट डेमोग्राफी एंड फैमिली प्लानिंग. Replacement level fertility is achieved when an average. So when do we say replacement level fertility? Please remember that there is a concept called as NRR. What is NRR? NRR stands for net reproduction rate. So net reproduction rate अगर 1 हो जाए, that funda is called as replacement level. So when will we get net reproduction rate of 1? ये NRR होता क्या है? For this you should remember this. ये एक simple table है. If you just read through the table, although all the students who already know what is GFR, GRR, NRR, TFR, it is super duper easy for you. But all the students who don't know about it, ये table देख लीजिए आप, and in this table is going to fetch you again one MCQ. What is GFR? It is the total number of children. Highlight करेंगे इस word को, total number of children a female will bear during her reproductive years. अगर इस definition को you complicate it, you see the total number of children. Highlight the word children. You're talking about the children. Total number of children a female will bear during her reproductive years. It's the same definition as GFR. Assuming the, please underline, assuming the age-specific fertility rate. So if you see two things, that is number of children with age-specific fertility rate, it is called as total fertility rate, which is better indicator, GFR or TFR. TFR is a much better than GFR. Next is, what is this gross reproduction rate? It is total number of daughters. Highlight करेंगे word को, it is the daughters. Daughters a female will bear during her reproductive years, assuming the age-specific fertility rates, is the same definition like TFR. TFR क्या था? Total number of children with age-specific. GRR क्या है? Total number of daughters with age-specific. हो जाएगा यहाँ तक. Next is NRR. NRR is the total number of daughters a newborn girl child will bear during her entire life, assuming the fertilities and death rates. Very important, frequently asked, which is the best indicator? Best indicator is the net reproduction rate. ये जो question आपने देखा था, that was related to the net reproduction rate. That net reproduction rate, what is net reproduction rate? Total number of daughters a female will bear during her entire life, assuming the fertilities and the death rates on her. So that is called as replacement level. So that is one daughter per couple होना चाहिए. अगर one daughter per couple है replacement level, so how many births होने चाहिए? It is 2.1 births. 2.1 births is what is the total fertility rate also, and that is what is the replacement level, that how many births should be there to have one daughter. So also ये भी कई दफा पूछा जाता है, what are the targets under the National Family Planning Program, NFPP, that is the National Family Planning Program. Very quickly, what is the couple protection rate? कितना होना चाहिए? It should be more than 60%. Total fertility rate should be more than, should be less than, not more than, should be less than 2.1. Net reproduction rate should be 1. That is what is the replacement level. Please remember that always you have to study smarter, not harder. ये हमेशा याद रखो, एक गुण है कि study smart, not hard. एग्जाम डिले हुआ, I know that many of us are very tired कि एग्जाम डिले हो गया, करना क्या है. बट एक बात हमेशा याद रखो, मेरे जहन में एक बात आई है कि you should always consider yourself to be lucky, because ये 2 महीने मिल गए तो ठीक है, हम इसको और we'll make our confidence much more boosted. एक छोटी सी बात है, पानी को बर्फ बनने में वक्त लगता है, सूर्य को अस्त होने के बाद उदय होने में वक्त लगता है, फसल को पतझड़ के बाद पकने में वक्त लगता है. किस्मत तो हम बदल नहीं सकते दोस्तों, पर बुलंद हौसले से किस्मत बदलने में भी वक्त लगता है. सो मेक श्योर यू गेट दिस राइट, दैट ठीक है थोड़ा सा डिले हुआ है, बट इन दीज 2 months आई एम गोइंग टू स्कोर मच बेटर देन व्हाट आई वुड हैव डन दैट बिफोर. सो इसको हमने इस तरीके से चलना है. विच ऑफ द फॉलोइंग इज नॉट ट्रू फॉर अंतरा? अंतरा क्या है? अंतरा इज मेड्रोक्सी प्रोजेस्टेरोन एसीटेट. Which of the following is not true? क्या लगता है? Which is false option? So dose is 150 milligram medroxyprogesterone acetate. This is correct. Given 3 monthly intradermal injections. क्या ये ठीक है? Safe for females who are breastfeeding. Is it right? Can be given to HIV positive females. क्या लगता है आपको? What do you think? Copy लो, उसके ऊपर लिख तो दो ना. What is the best answer? So Antra is beta medroxyprogesterone acetate. Yes, this is correct. Dose is 150 milligram. It is given every 3 monthly. It is given every 3 monthly, but it is not intradermal injection. It is intramuscular injections. It is given as intramuscular injections. It is safe for females who are breastfeeding. Absolutely correct. It is given only after 6 weeks of delivery and can be given to HIV positive females. ये भी बिल्कुल सही है. It can be given to HIV positive females. So if you talk about Antra, please remember that Antra can have various side effects and it cannot be given. It is given, it it is not given. It is contraindicated to females with unexplained vaginal bleed, stroke or severe diabetes, females who are with past or the present breast cancer, active hepatitis or liver tumor, and desire for rapid return. Why rapid return? Because iski return to fertility happens only after 7 to 10 months isko lagte hain for return to happen. एंड एक और बात है, जिन फीमेल्स में ऑस्टियोपोरोसिस एंड फीमेल हु हैव लो बोन मिनरल डेंसिटी, अंतरा इज नॉट गिवन टू दोस फीमेल्स बिकॉज अंतरा कैन कॉज loss in the bone mineral density, specifically in the first 2 days, first 2 years of the use of antra. So ये कुछ अंतरा की बातें हैं. It is safe for females who are doing breastfeeding. This is also true and can be given to HIV positive females. This is also true. So which is the wrong one? Option B. It is given 3 monthly. That is correct, but intradermal nahi hota. It is given as intramuscular injection. Next is, which of the following is incorrect for multi-load 375? So multi-load 375, it is a newer copper device. So this is a copper 375. It does not have copper on arms. This is correct answer. इसके जो अगर आपने copper device देखा हो, copper 375, this is what is the copper 375, IUD 375. So this IUD 375, it is a U-shaped device. I'm sorry. It is a U-shaped device, and this U-shaped device, it has a thread which is a blue color thread, and it is made up of nylon thread. It is a U-shaped device made up of nylon thread, and this is what is copper 375. It does not have copper on the arms. Make sure it is contrary to what you see as an intrauterine device, that is the copper 380A. Copper 380 was a simple T-shaped device with copper on the arms. So इसके अंदर पीछे A लगता था. A means copper is there on the arms. So if you just remember this, it does not have copper on the arms. This is true. It is inverted T-shape. It is not inverted T-shape. This is wrong answer. It is inverted U-shaped device. It is inverted U-shaped device. That is the wrong answer. With 375 millimeter square, this is correct. Short-term IUCD valid for 3 years. ये भी बिल्कुल सही है. Blue color nylon thread, ये भी सही है. So option A, C, and D are true. Which is the wrong one? That is the option B. Option B is the best possible wrong answer over here. So this is again a 5-star MCQ topic, NFHS 5. Very recently, बेटा 2019-20 में जिन स्टूडेंट्स ने ऑलरेडी ये पढ़ा हुआ है, they must be knowing the answer for this. But those students who have not read about NFHS 5, make sure you read about NFHS 5. So all are correct. All are correct, except which of the following for NFHS 5? क्या लगता है आपको? It is conducted by International Institute of Population Sciences. It has 4 schedules. It is conducted every 5 years. It is conducted by Ministry of Women and Child Development. So all are correct except. Please remember that India mein there are 2 systems. We have SRS and we have NFHS. SRS is conducted every 6 monthly to 1 year. It is called as sample registration system. It gives you 4 indicators: crude birth rate, crude death rate, infant mortality rate, plus MMR. MMR का जो publication that is separate. So if you get a question which is not included in SRS, answer is MMR. MMR is given as a separate publication, but yes, these are the 4 indicators which we look forward under the SRS system. NFHS, National Family Health Survey, it is conducted by Ministry of Health and Family Welfare. ये Ministry of Health and Family Welfare conduct करवाती है और ये बहुत सारे indicators देती है, like what is the sex ratio, literacy rate, and I think this data you should be remembering. So how to remember this data is data का अभी आप snapshot लो and keep this data with you, and this is what is very important data. It can be asked like what is the total fertility rate, sex ratio भारत का कितना है, literacy rate, underweight for age, any method of contraception, anemia females में कितना है, total dependency ratio, all these are data by NFHS and they can be asked in your exam. So anyways, coming back to the story about NFHS, NFHS is conducted under the Ministry of Health and Family Welfare. So is Ministry of Health and Family Welfare has given the task to International Institute of Population Sciences, and there are 4 parts in this: male, female, biomarker, and household. These are the 4 schedules. So if you look at this question, conducted by International Institute of Population Sciences, this is true. It has 4 schedules. This is also true. It is conducted every 5 years. Yes, ये भी correct है. It is conducted by Ministry of Women and Child Development. This is the wrong answer. It is conducted by Ministry of Health and Family Welfare. A very quick review about what are the most common cause of death. बेटा अगर आपको एग्जाम में सीधा सीधा पूछ ले, what is the most common cause of death for infants? In infants. In infants. As per the SRS data, as per the SRS review or Ministry of Health and Family Welfare, best answer for us would be low birth weight and prematurity. This is the single best answer. But agar aapse exam mein, there's a special MCQ, if they ask you using this word, medical certificate cause of death. This data is a special data. It was released in year 2021. This data tells you that most common cause of death in infants and neonates, it is hypoxia. It is hypoxia and birth asphyxia. Birth asphyxia, which is more important than low birth weight according to this MCCD survey. But if nothing is given, I think it is always safe to mark low birth weight prematurity. But that is the better answer. But medical certificate cause of death, if the question is saying, then you invariably have to go with hypoxia and birth asphyxia. This is the latest SRS bulletin, which was released in May 2022. And according to this, what is the infant deaths in India? It is 28 deaths. The crude birth rate is 19.5 and the crude death rate is 6.0. A few questions from nutrition. Next is a few questions from nutrition. Under the ICDS growth charts, mild to moderate malnutrition is featured. Very few questions remaining. Let's finish this whole thing off. In ICDS growth charts, mild to moderate malnutrition is featured if the child is when. So in ICDS growth charts, beta, ICDS growth charts, ये आपको by heart पता होना चाहिए. There are 3 curves. You have the first curve, the second, and the third. The first reference line, this reference line, it relates to the median of the MGR standards. I have told this multiple times in the class also. This can be asked. It's a 5-star MCQ topic. Growth charts. What is the first reference line? That is the median. Please remember, the first reference line is the median. Then is the second reference line. That is -2 standard deviation. Third reference line is -3 standard deviations. If the child is following between the median and the -2, it is called as the normal zone. If the child is following below -2, it is mild to moderate malnutrition, and below -3, that is severe malnutrition. So अगर ये आपको समझ है, so ये question ने पूछा mild to moderate malnutrition is featured if the child is having between what and what. If it is between +2, -2, between -1 and -3, between -3 and +3. So what do you think? It is mild to moderate malnutrition is if the child is having below -2 and -3. So let's make this as -2. So mild to moderate malnutrition will be below -2 standard deviation and -3. एक छोटा सा correction किया है. So it is below -2 standard deviation and -3 standard deviation. Between that point, below -3 क्या होगा? That is severe. This is mild to moderate malnutrition. This is mild to moderate malnutrition, and that will be the best answer between -2 and -3 standard deviation. Richest source of linoleic acid. ये biochemistry का question है. Which of the following is the richest source for linoleic acid? What is linoleic acid? Linoleic acid, omega-3 or omega-6? Please remember, linoleic is omega-6 fatty acids. So ये richest source काफी दफा पूछते हैं. If they ask you alpha linolenic acid, that is omega-3 fatty acid, what is the richest source? It is flaxseed. If they ask you ecosa pentanoic acid, what is the richest source? It is fish oils. Fish oil is richest source for icosapentaenoic. Icosapentaenoic is a type of, it is a long chain derivative of the omega-3 fatty acids. What is omega-6? Omega-6 is what is called as the linoleic acid. Linoleic acid, what is the richest source? That is safflower. Next is, we can also have grape seeds oil, cotton seeds, or walnuts. They are also rich. Apart from like safflower, if you get the single best answer, please mark safflower. Oleic acid. What is oleic acid? Beta, oleic acid is what is MUFA. It is also called as the omega-9 fatty acid. It was earlier called as the omega-9 fatty acid, but now we call it as MUFA, or the monounsaturated oleic acid. What is the richest source? Oleic olive oil. So oleic acid, olive oil, groundnuts, canola, avocado. Avocado is the fruit which has the richest MUFA. So all these questions can be asked. Which is the richest source for omega-9? That is olive oil. So richest source for linoleic. What is the best answer over here? You see safflower, you mark safflower. That is the best answer. All of the following are correct for human milk. Again, a 3-star MCQ beta. Which of the following is correct for human milk except fore milk is more watery? What do you think? Yes, absolutely correct. Fore milk is always watery. Hind milk is always fatty. This is correct. It is rich in vitamin C. Yes, this is also correct. It is low sodium. Yes, this is also correct. It is a rich source of calcium. Unfortunately, this is not correct. Human milk has the lowest calcium. This is false. So what is the best answer over here? It has been asked multiple times. Just one slide, and this again one slide is going to fetch you at least one question in your exam. Either this could be from pediatrics, from PSM, from gynae. Human milk. Human milk is rich in, it is rich in PUFAs, it is rich in arachidonic acid, it is rich in cysteine and taurine, which are the proteins. It is also rich in whey proteins. What are the whey proteins in the human milk? It is lactalbumin, lactoferrin. We also have lysozymes, IgAs. It has high iron bioavailability. Please note that the iron is low, but the absorption capacity of the iron is very high. It has low calcium, low sodium, but high vitamin C. This is a 3-star MCQ topic. Human milk, very frequently asked in your exam. Next is one question from food adulteration. So approximately 30 individuals from a small community from rural area in West Bengal report of having, very interesting question, they report of having bilateral pedal edema, breathing difficulty, that is dyspnea, blurring of vision, which could be due to I don't know what, and there is diarrhea. So some reported have glaucoma. Glaucoma could also lead to blurring of vision and congestive cardiac failure like features. The disease was linked to adulterated oil consumption. What is the toxin responsible? This question is asking about adulteration of the mustard oil. Mustard oil can be adulterated with oil from Argemone mexicana. Argemone mexicana can be the adulterant. This is the adulterant in the mustard oil. So what is the name of the toxin? The toxin name is sanguinarin. Remember marine, remember water. The disease we can have is epidemic dropsy. The disease is epidemic dropsy. So say 5 points with me for epidemic dropsy. Epidemic dropsy. The disease name is drop. Drop is liquid. The disease is liquid. The food product is liquid. That is mustard oil. It is adulterated with Argemone mexicana. What is the toxin in Argemone mexicana? That is sanguinarin. Disease is watery. The food product is watery. The toxin is also watery. Sanguimarine, neer, sanguinarin. Remember it somehow. And last is the very characteristic clinical features of epidemic dropsy. What are the characteristic clinical features? There is water in the eyes, glaucoma. There is water in the heart, congestive cardiac failure. There is water in the legs, pedal edema. There is water in the stools also, that is diarrhea. So make sure you get this question right. Very frequently you get questions. There's a small table. This table is looking small, but this is a 7-star table for you. Very frequently you get question on food toxicants. What about neurolathrism, epidemic dropsy, endemic ascites, aflatoxicosis, and ergotism? So this is one table which can fetch you, again, very frequently they can fetch you at least one MCQ correct, and make sure you get this question right about food adulterations. So what is the best answer over here? The best answer over here is sanguinarin. Which of the following is not correct regarding the Poshan Abhiyan? This was launched very recently in 2018 only. We launched it, Poshan Abhiyan, which is not correct, which is incorrect. So, initiative under the National Nutrition Mission to reduce anemia among children by 3% per year, reduce stunting by 2% per year, provide midday meals to students until class 8. So, what do you think is the false option? If you look at the midday meal system, Poshan Abhiyan, but it was started in year 2018 only. It was started in March 2018, 8th of March 2018. The full form of Poshan is Prime Minister Overarching Scheme for Holistic Nourishment, and it is launched by Health and Family Welfare. In this, we wanted to decrease the anemia prevalence. We wanted to reduce the anemia prevalence. We wanted to reduce the prevalence of anemia by 3% per year and reduce the low birth weight, underweight, and stunting by 3%, 2% per year. That is 6% in total 3 years. So that is what is this Poshan Abhiyan. It is initiative under National Nutrition Mission. This is true. It is to reduce anemia by 3%, low birth weight by 2%. Remember, anemia is a bigger problem, 3%. Low birth weight is not as big as anemia, that is 2%. So anemia by 3%, that is also true. It is to reduce stunting or low birth weight by 2%, that is also true. It is to provide free midday meals. No, this is not correct. This is false. It is not about providing midday meals. It is about providing them iron supplements, providing them nutrition food to everyone. That is what is the Poshan Abhiyan. Government of India, the Ministry of Education, beta, very recently in year 2021, in year 2021, they started with this new scheme called as the Prime Minister Poshan Shakti Nirman scheme, again called as the Poshan. It is by the Ministry of Education. It is to provide them midday meals. So now we don't have a midday meal program or a midday meal scheme. We have a Poshan scheme. Poshan scheme is launched by Ministry of Education, and that is for children from class 1 to class 8. So make sure you get this right. You have to read it. It is about the Poshan scheme या Poshan Abhiyan. So ये भी question आ सकता है. Last topic to finish off the whole game, national health programs and communicable disease. Just few minutes, and this will be the last section, national health programs. An Assamese female in second trimester reports to the OPD with falciparum malaria. Management will include, what do you think? So this is a female who is pregnant, Assamese female who is pregnant. Assamese means, like, of course, from Assam, but it is pertaining to the northeastern states. So now a female in northeastern states, she's pregnant and she reports with a falciparum malaria. Management will include. So please remember that the management for Plasmodium vivax infection, management for the Plasmodium vivax infection, vivax, that is chloroquine plus primaquine. For falciparum in northeastern states, it is ACT-AL, that is artemisinin based combination therapy, artemether plus lumefantrine for 3 days plus primaquine. Falciparum in all other states, we give ACT-SP, artesunate plus sulfadoxine plus pyrimethamine plus primaquine as single dose. In pregnant females, we first trimester is quinine salts, and in the second and third trimester, we give a region-specific ACT, no primaquine. Primaquine, please note, is contraindicated in infants, it is contraindicated in G6PD, it is contraindicated in pregnant females. In mixed infections, we give area-specific ACT plus primaquine for 14 days. So from the Vivax, you pick up primaquine, from the falciparum, you pick up the ACT. That is what you do for mixed infections. So coming back to this question, Assamese female in second trimester reports to the OPD with falciparum. What do you think is the best answer over here? With falciparum, we will give to the female only artemether and lumefantrine without primaquine. So why? Because primaquine is contraindicated. That is the best possible answer. A very frequent asked topic. I'm not going to discuss this topic, but just to tell you that you can get a lot of questions on Anopheles, Aedes, Culex, and Mensonia mosquito also. There's a very quick review about the disease which is caused, the breeding habits, the eggs, and the larva. Anopheles, last point, is adult. Anopheles sits in a slanting or an inclined position. The Aedes is parallel to ground. The Culex is hunchback position, and Mensonia is in a squatting position. So this can be asked in your exam about the mosquitoes. Make sure you get this question right. This is also a high yield topic. Malaria is again a 3 to 4 star MCQ topic. Very frequently you get this question in your exam. Malaria, mosquitoes. So make sure you get this right. Coming to the next MCQ, drug of choice for prophylaxis or lymphatic filariasis in the community level includes all except. So, drug of choice for prophylaxis or lymphatic filariasis at community level includes all except. So, albendazole, DEC, ivermectin, these are already given as the triple drug regime, and this is given as annual doses. Please remember, in all the lymphatic filariasis area, we give one tablet of albendazole, DEC, and ivermectin, one each, to all people in the area. Miltefosine beta is used for Kala Azar. Miltefosine is not drug which is used in lymphatic filariasis. Miltefosine is for Kala Azar. Lymphatic filariasis drug of choice is DEC, but for prophylaxis we give three drugs. What are the three drugs? Albendazole, DEC, and ivermectin. So a lot of times you get questions on what is the drug of choice under the national programs in India. So Kala Azar, please remember Kala Azar, the drug of choice is liposomal amphotericin B or miltefosine. The first drug is LAMB, liposomal amphotericin B. Lymphatic filariasis, we give DEC. Leprosy, a lot of times there is confusion in mind of students. What should we follow? The WHO regime या फिर आपको follow करना है NLEP? Please remember, I would always say that government of India, in India हम लोग NLEP regime follow कर रहे हैं. NLEP में बेटा there are 2 drugs for possibacillary for 6 months, 3 drugs for 12 months for multibacillary. WHO regime जो है, they give 3 drugs for 6 months or they give for 12 months. 6 months in case of possibacillary and 12 months in case of multibacillary. But ये WHO regime है. अगर आपको क्वेश्चन में पूछा जाए कि WHO regime बोलना है तो आपने WHO बोलना है. मेरे हिसाब से I would always recommend that अगर if the question is general, if the question is generally saying that what is the treatment we give for leprosy, then we need to mark the NLEP regime. NLEP regime में बेटा 2 drugs for 6 months and 3 drugs for 12 months. HIV के लिए we have the standard regime of TLD, tenofovir, lamivudine and dolutegravir. Tuberculosis के लिए drug sensitive TB, we give 2 months of HRZD plus 4 months of HR&E. Malaria ka treatment we have already discussed. Either it could be Plasmodium vivax malaria or we can have the falciparum malaria. Vivax में chloroquine for 3 days, primaquine for 14 days. Falciparum में we give ACT SP या ACT AL for 3 days plus primaquine as single dose on day 2. So these are the drug of choices very frequently you get in your exam, and that is about this question was about prophylaxis. Best answer over here is miltefosine. In leprosy control program, indicator for efficiency for early diagnosis of cases. So please remember that leprosy में early diagnosis cases का what is the best indicator? It is about the disability rates among newly diagnosed. This is, I think, a 5-star MCQ because last के 4 एग्जाम्स भारत देश में पिछले 2 साल में नीट, INI सेट, FMG and UPSC, चारों एग्जाम्स में in last 2 years every exam was having a question on leprosy. So make sure you get this question right about leprosy. जैसे मैंने आपको पोलियो का बताया ना कि पोलियो यू शुड बी स्टडिंग इन एंड आउट, ऐसे ही लेप्रोसी यू शुड बी स्टडिंग इन एंड आउट. सो लेप्रोसी, कॉलरा, पोलियो, टाइफॉइड, ये क्वेश्चंस के ऊपर बहुत दफा एग्जाम में क्वेश्चन पूछा जाता है. इन टॉपिक्स के ऊपर बहुत दफा क्वेश्चन पूछा जाता है. मेक श्योर यू गेट देम राइट. So in leprosy control program, indicator for efficiency of early diagnosis, that is disability among newly diagnosed cases. This is the best indicator for efficiency of early diagnosis. Please remember, 4 ही indicators आपको याद करने हैं. ये पूरी list है, but this whole list you don't need to remember. I would request you to remember only these 4 indicators. Core epidemiological indicator. New cases कितने detect हो रहे हैं? ANCDR, this is the operational indicator. Grade 2 disabilities, G2D मतलब grade 2 disabilities per 10 lakh population. This is about leprosy awareness in the area or early diagnosis of the cases. Cure rate is again operational. Prevalence rate is again operational. It is also a policy indicator, cure rate. So make sure you get these question right. These are the core epidemiological indicators. एक और सवाल आता है about leprosy prophylaxis. To whom you will give the leprosy prophylaxis? Leprosy का prophylaxis will be given to everyone in the house who is in the same household for more than 1 year, for at least for 1 year. 3 houses on each side, neighbors में 3 houses आगे पीछे ऊपर नीचे left right, social contacts who are in contact with the leprosy case for more than 20 hours per week for more than 3 months. In these cases you are going to give the leprosy prophylaxis, and that is a few points about leprosy. Which of the following is not correct regarding cervical cancer vaccine? ये भी एक talk of the town है. This is also a 3-star MCQ because very recently in 2021 only government of India had introduced this new cervical cancer vaccine. Beta, Gardasil is quadrivalent. What do you think? Yes or no? Yes, I think this is a घिसा हुआ MCQ. Gardasil is quadrivalent. There is a Gardasil nonavalent vaccine. That is 9 valents, 9 strains are there. 6, 11, 16, 18, that is regular strains, plus 31, 33, 45, 52, 58. This is also true. That is the 9 valent. Sarvavac is quadrivalent. This is what I was talking. This is a new vaccine, beta, Sarvavac. This is a new vaccine which has been introduced in India, and this is also true. It is a quadrivalent vaccine, 6, 11, 16, 18. Cervarix vaccine is bivalent. So bivalent is 6, 11 ki jagah it should be 16 and 18. It is not 6 and 11. So this is unfortunately the false answer. You are going to mark this. So which of the following is not correct? Not correct mark karna tha. D is the wrong answer. A few points about Sarvavac. Sarvavac is important for your exam. You should know about Sarvavac. Sarvavac, target strains, it is a quadrivalent vaccine, 6, 11, 16, 18. 16, 18 is the most common strains which cause cervical cancer. And this vaccine type, it is a L1 vaccine-like proteins. It is approved for age group 9 to 26 years. It is given in 2 doses, 6 months apart, and 3 doses for immunocompromised. But please remember, the schedule is 2 doses with a gap of 6 months. It is a cervical cancer vaccine which has been introduced by Government of India. दो चार बातें कर लेते हैं about healthcare management. I think we have a few minutes remaining. All are true about Ayushman Bharat. What do you think? All are true about Ayushman Bharat except all are true about Ayushman Bharat. It is for economically deprived families, provides comprehensive primary health care with community health officer. It is free treatment for government and private. It covers up to 5 lakh. So please remember, very frequently ये question आ सकता है आयुष्मान भारत के ऊपर. आयुष्मान भारत स्कीम. आयुष्मान भारत स्कीम के दो पहलू हैं. दो पहलू तो नहीं, दो आर्म्स हैं, दो पार्ट्स हैं. One is about the health insurance and one is about the CPHC, comprehensive primary health care. Health insurance में बेटा we are giving 5 lakh rupees per family to 10 crore families, that is 50 crore population without any criteria for age, gender, type of disease or whatever. Under the comprehensive primary healthcare system, the healthcare system of India is taken up. जो पुराने सब सेंटर थे ना हमारे सब सेंटर, they have been upgraded to health and wellness centers with the post of community health officer. So if you understand this, all are true for Ayushman Bharat. It is for economically deprived families. This is true. Provide comprehensive primary health care. Yes. Free treatment in government. Yes. It covers up to 1 lakh ki jagah. It is up to 5 lakh per family. So which is the wrong answer? It is option D, which is the wrong answer. All are true for Ayushman Bharat except. Which of the following is not a component of intervention under the Anemia Mukt Bharat? This is again one MCQ which is a 7-star MCQ. ये पिछले 2-3 साल में हर एग्जाम में पूछा गया है. अनीमिया मुक्त भारत. Beta, in Anemia Mukt Bharat, before I land up into the MCQ, Anemia Mukt Bharat mein there are 6 interventions which you need to remember for your exam. 6 interventions like iron folic acid supplements, deworming tablets, behavior change communication का जो theme है, that is to have a strong body and a smart mind. Field testing using digital hemoglobin testing instruments, digital. फोर्टिफिकेशन ऑफ फूड प्रोडक्ट्स. फोर्टिफिकेशन किन से कर रहे हैं, इसका नाम हम दे रहे हैं F+ फोर्टिफिकेशन. F+ फोर्टिफिकेशन में आयरन रहेगा, फॉलिक एसिड रहेगा, प्लस वी आर आल्सो एडिंग विटामिन B12. So all are parts of the fortification of the food products. They are given as F+ food products. असेसिंग द नॉन न्यूट्रिशनल कॉज ऑफ एनीमिया। ये 6 इंटरवेंशंस आपको पढ़ना होगा, आपको याद रखना होगा फॉर योर एग्जाम। अबाउट दिस आयरन फॉलिक एसिड किस एज ग्रुप में कितना डोज है, दिस इज अ वेरी घिसा हुआ एमसीक्यू। प्रेग्नेंट फीमेल्स, लैक्टेटिंग फीमेल्स, WRF females, they will be given 60 milligram plus 500 milligram. Pregnant female will be given daily. WRF female will be given weekly. Red color tablets. Adolescent girls, adolescent boys, 60 milligram plus 500, but the color of the tablet is a blue color. In children 5 to 10 years, 5 to 9 years of age, we are giving 45 milligram of iron and 400 micrograms of folic acid given as weekly tablets, pink color tablets. In age less than 5 years, after 6 months, we are giving 20 milligram of elemental iron, 100 micrograms of folic acid. It is given as bi-weekly. सो अगर ये क्वेश्चंस आपको समझ आ गए, ये टॉपिक आपको आ गया, दिस इज व्हाट इज अनीमिया मुक्त भारत। ये 2 स्लाइड्स आप कर लीजिए, स्लाइड नंबर 1 एंड स्लाइड नंबर 2, दैट्स ऑल दैट यू नीड फॉर योर एग्जाम फॉर अनीमिया मुक्त भारत। सो व्हिच इज नॉट ए कंपोनेंट, आपको गलत वाला बताना है, सोच के बताओ। स्ट्रॉन्ग बॉडी स्मार्ट माइंड कॉन्सेप्ट, दिस इज ट्रू। फील्ड टेस्टिंग ऑफ HB यूजिंग डिजिटल इंस्ट्रूमेंट्स, ट्रू। Daily IFA tablets for females in WRA age group. 6 monthly deworming tablets to all population. 6 monthly deworming is true. Is it given daily? Abhi to aapne kiya, it is given only weekly. This is unfortunately the wrong options because in WRA age group mein we are giving weekly instead of daily. So that is the wrong answer over here. मोस्ट इंपॉर्टेंट प्री रिक्विजिट फॉर सैनिटरी लैट्रिन, क्या लगता है? व्हाट इज द प्री रिक्विजिट फॉर सैनिटरी लैट्रिन? प्लीज रिमेंबर, सैनिटरी लैट्रिन कब आप कहेंगे कि लैट्रिन इज सैनिटरी? सैनिटरी लैट्रिन वी से व्हेन देयर इज वाटर सील। अगर स्क्वाटिंग प्लेट है, नहीं है, स्मूथ स्लोप है, एडिक्वेट ड्रेनेज है, नहीं है, बट सैनिटरी लैट्रिन इज व्हेन देयर इज वाटर सील। Very frequently they ask you which is the best temporary method, camp लगेगा या कुछ होगा, what is the best method for latrine, for waste sewage disposal? It is burial method. इसको हम ट्रेंच मेथड भी कहते हैं। ट्रेंच मेथड, खड्डा खोद के उसको अर्थ में डाल दो, सॉइल में डाल दो, दैट इज ट्रेंच मेथड और द बरियल मेथड। व्हेन डू वी से सैनिटरी लैट्रिन? आंसर इज RC लैट्रिन विद द वाटर सील। स्ट्रेंथ ऑफ सीवेज इज डिटरमिन्ड बाय बायोलॉजिकल ऑक्सीजन डिमांड। इनर्टाइजेशन कब कहते हैं? इट इज मिक्सिंग ऑफ द केमिकल वेस्ट विद सीमेंट। What is Bangalore method? Anaerobic layering method of sewage with rubbish. Screw feed और pulverization is shredding of metals. फिर ये कई दफा पूछा जाता है कि वेस्ट डिस्पोजल में कितना एरिया आपको चाहिए। सो प्लीज रिमेंबर कि अगर हमारे पास वेस्ट एरिया कितना चाहिए, 10 to 50 फीट चाहिए फॉर 1 acre लैंड फॉर एवरी 10,000 पॉपुलेशन, इट्स नॉट पर लैक, फॉर 10,000 पॉपुलेशन पर ईयर। डीप ट्रेंच होगा, शैलो ट्रेंच होगा, दिस इज फॉर सीवेज डिस्पोजल। Sewage disposal, septic tank minimum should be 200 liters which should be cleaned every 5 years. ये कई दफा आपको सवाल पूछते हैं, this is very frequently asked in your exam. This is also a 3-star MCQ topic about waste disposal methods in India. So if you understand this, it's a direct answer. What is the best way for sanitary latrine? Answer is, it is a water seal. Which of the following is not a mass approach for health communication? Mass approach कौन सा नहीं है for health communication? I think this is just second last question and that is the end of the session. Which of the following is not a mass approach for health communication? Folk methods, role play, posters, health exhibition. So if you just look at this small table that I have prepared for you, we can have various methods of communication. We can have individual method, group और mass method. Individual मतलब हो गया मैसेज डालना, personal talks, SMS. Mass method is like TV, radio and all that. Group method, what is symposia? Symposia is series of lecture by experts. What is panel? Panel discussion is discussion among the experts in front of audience. What is workshop? Workshop is skill enhancement. Role play, बहुत दफा students get confused in role play. Role play is not the nukkad natak or the folk play. Role play is when a person will do enacting and teach about some skill, communication skill. Delphi क्या होता है? Delphi is to solve complex problem. It is group discussion among the groups. Groups बनाए छोटे छोटे and we discuss among the groups. That is what is a Delphi. It is to solve complex problems. So make sure you get this very easy topic right. And ये question, which of the following is not a mass method of communication? Folk methods. Folk method क्या होता है? जो नुक्कड़ नाटक है. Posters, yes, it is a mass method. Health exhibition, yes, it is a mass method. ये जो option है ना, role play is very confusing. Role play is actually a group method and not a mass method of communication. Last question to close off this whole session: which of the following item is disposed of in a red bin under the biomedical waste management 2016? रेड बिन में, रेड कैटेगरी में कौन सा डालेंगे? दिस इज अगेन अ 7 स्टार, मेरे को बोलने की भी जरूरत नहीं है. सो ये 7 स्टार एमसीक्यू है. Which of the following item is disposed of in the red bin and the biomedical waste management? Empty vacuum Foley's catheter, blood-stained gloves, used face masks and syringes with fixed needles. कौन से डालोगे रेड कैटेगरी में? सो आई होप आपको सबको याद होगा कि ये जो येलो कैटेगरी है इसमें जाएगा आपका ह्यूमन वेस्ट, प्लासेंटा, फीटस, सॉइल्ड वेस्ट कौन सा होता है? ऑल द कॉटन, प्लास्टर, कास्ट, एनी ड्रेसिंग मटेरियल, discarded linens, expired drugs, cytotoxic drugs are given a special symbol. इनको एक स्पेशल सिंबल अलग बैग में डाला जाता है बेटा. इस बैग के ऊपर साइटोटॉक्सिक सिंबल होता है, सी, ऐसा ट्रायंगल विद अ सी. आई विल मेक इट ओवर हियर. इट इज साइटोटॉक्सिक का ऐसा सिंबल होता है. So cytotoxic के लिए you have a special symbol and a special C. Then all the microbiological, clinical laboratory, microbiological waste includes blood bags. Please remember, blood bags are yellow category. All the liquid chemicals from laboratories, infectious waste, liquid waste, silver X-ray films, ये सारे जो जाएंगे ये yellow category. Red category, please remember, red category is what is Foley's catheter, IV bottles, drip sets. Please remember any type of gloves. Blood stained gloves है, नहीं है. Syringes without needle. Syringe with needle will go to white category. Without needle will go to the red category. Vacutainous dial tube. They all go to the red category. ब्लू में क्या जाएगा? ब्लू में रिमेंबर, ब्लू में जाएगा ग्लास एंड बॉडी इम्प्लांट्स विच आर ऑर्थोपेडिक मेटालिक बॉडी इम्प्लांट्स. Orthopedic metallic body implants like screws and plates which contain titanium, they go into the blue category. Broken glass, broken ampules and empty vials, they all go into the blue category. What goes into the white category? White category is all sharps and blades, syringes with fixed needle, they go to the white category. So if you have remembered this, if you have understood this, ये बहुत easy question है. Which of the following will go to the red bin? So empty vacutainer, yes, they go to the red color bin. Foley's catheter, they go to the red color bin. Blood stained gloves, they will go to the red color bin. Used face masks, beta, ये जाएगा yellow category में. Syringes with fixed needle, ये कहाँ जाएगा? Syringe with fixed needle. Needle fixed है, you cannot break it open, ये जाएगा white category. कोई और इसमें डाउट? मोस्टली स्टूडेंट्स को डाउट आता है पीईपी के ऊपर. प्लीज रिमेंबर, जो हेड कवर है, हेड कवर, ये जाएगा येलो कैटेगरी में. उसके बाद आता है गॉगल्स. गॉगल्स जो जाता है दैट गोज इनटू द रेड कैटेगरी. देन यू हैव फेस मास्क. फेस मास्क विल गो टू द येलो कैटेगरी. देन यू हैव एप्रन. एप्रन विल गो इनटू द येलो कैटेगरी अगर वो लिनन या सेमी सिंथेटिक है. बट इफ द एप्रन इज मेड अप ऑफ प्लास्टिक, if the apron is made up of plastic, then it goes to the red category. So make sure you get this right. And next आता है gloves. Gloves go, हमने अभी बात किया, gloves, any type of glove will go to the red category. And last is shoe cover. Shoe cover, shoe cover will also go to the yellow category. So that's all about the PEP. अगर hazmat suit पूछ लिया, which is a plastic suit, anything which is plastic beta, that goes into the red category. Anything which is rubber, plastic or tube, that will go to the red category. And so with that, I'd like to thank you so much for watching this whole module on very crash review. I've tried to cover every important topic and this was a total list of around 45 MCQs जो हमने discuss किए आपके साथ. Any doubts, please feel free to comment. मेरे बस एक याद रखो कि किस्मत बदलने में टाइम लगता है. हर बुलंद हौसले से किस्मत बदली जाएगी. इसको अपने आप को डटे रहो एंड मेक श्योर दैट यू आर डूइंग ऑनेस्ट वर्क. ये सबसे जरूरी है दैट योर डेडिकेशन, योर ऑनेस्टी इज गोइंग टू पे इट बैक टू यू. सो डोंट थिंक कि आप इस टाइम पे 2 महीने रिलैक्स कर लेते हैं, इधर उधर चल जाते हैं, खा पी लेते हैं. दैट इज ऑल बेकार की बात. इन चीजों से आपका स्कोर बढ़ेगा नहीं, इन चीजों से डाउन होगा. कीप योर मोमेंटम हाई. हम लोग आपके लिए हमेशा, वी आर ऑलवेज देयर विद यू. We will be keeping doing these sessions like these very often so that you are on your track. Plus आप प्लीज अपने आप को मोमेंटम ब्रेक ना करें और एमसीक्यूज करते रहें, एंड दैट इज व्हाट इज गोइंग टू पे यू ऑफ. सो ऑल द वेरी बेस्ट. हैव अ गुड नाइट एंड थैंक यू सो मच फॉर वाचिंग दिस मॉर्निंग.